And now on the news at 10, the death of former Miss USA Cheslie Kryst, bringing renewed focus to the importance of mental health. News 12's Tama Ponton joins us live from the newsroom with important insight from health professionals. Tama.
Well, Macy, mental health experts say when someone dies by suicide and we talk about it, it is important to not make any assumptions about the person's life or what you think you may know about what they might have been experiencing.
It's just so hard to know from an outsider perspective what's going on inside somebody else's life.
Dr. Scott Krakauer, a psychiatrist with Northwell Health, says the death of Cheslie Kryst, the 30-year-old former Miss USA, could leave some people wondering why she died by suicide.
Every case is different. Every person's different.
But Dr. Krakauer says it is important that we don't pass judgment on her death or what we think we may know about her life.
You don't know stressors people are going through. You'll never really know 100%.
There's this common misconception that if we talk about suicide, it's dangerous. But the reality is, if we talk about suicide the wrong way, is when it gets dangerous.
Ann Dubell, an assistant director with Suffolk County's Response Crisis Center, says when we talk about how Cheslie Kryst died, it's important to remember we don't know how those close to us may be affected by what we say.
Some of the important things to avoid are saying things like commit suicide. We always use the phrasing of died by suicide. We always say an attempt survivor when we are using that language, because the reality is that our language matters with such a sensitive issue.
Dubell and Dr. Krakauer say some possible warning signs a person may be having a mental health crisis include worsening moods, a change in sleep habits, a drastic change in their behavior, a change in relationship with drugs or alcohol, a lack of interest, even them talking about suicide. They say it's important for everyone to know there is help for people who may be in crisis.
There's always something available, like there's a therapist to speak to, that there's somebody you can talk to and vent to, that there are treatments out there.
I'm Tama Ponton, News 12.
Well, Tama, it is such a sensitive topic, and some people may not feel comfortable reaching out to a doctor or even have the resources to do so. So what can people do if they might be in crisis?
Well, Macy, the psychiatrist we spoke with says people can even go to urgent care for help and talk to someone you trust, like a teacher, a faith leader, or even someone in your community. If possible, make that your first start and talk about what you're experiencing. Macy?
All right, thanks, Tama. And if you or someone you know is in need of help tonight, you can go to our website, news12.com, for a list of resources and phone numbers that you can call right now. Please do not hesitate to reach out.